Good morning to all. Now we are going to see about the how to conduct the nursing rounds. It is a continuation of introduction to nursing rounds. So here it has given certain way to conduct the nursing rounds. The example of how as a nursing teacher they will conduct the nursing rounds with the students. So when we are going to, as a teacher, we are going to conduct a nursing rounds. The teacher, we have to go near to the patient bedside along with the students, or else we have to go stand outside of the patient door. So this is the first step. Second step, so while standing outside of the door, out of his hearing, the teacher has to discuss what is the objective of conducting these nursing rounds. What are the things they have to observe in the patient and patient bedside that they have to explain to the students. After that, they have to knock the door and enter inside the patient room, and they have to meet the patient. Then they have to introduce themselves with the patient and get consent from the patient by making a cordial relationship with the patient. Next, after that only, they start to do the nursing rounds. Once they conducted nursing rounds for a particular patient, then they have to move towards the next patient. So after finishing each patient, or else after finishing all the patients, they have to have a mini discussion session. In the discussion session, they have to discuss briefly about the outstanding points what they observed on the patient side as well as patient during while conduction of nursing rounds. That should be discussed. Followed that, the reporting is very essential. How should be the nursing reports means it should contain the patient condition, nursing care, medical care and prognosis. That's all about the way to conduct nursing rounds. Next, while conducting the nursing rounds, we have to assess the 5 P's. The first P is pain. We have to ask the patient about how is your pain. Next, we have to ask if the patient had any pain, you have to ask about the pain. Next, position. Are you comfortable? You have to ask. If needed, we have to turn the position of the patient to make the patient to feel more comfortable. Next, party. Party in the sense we have to assess the bathroom needs of the patient. That is very essential. Next, periphery. Here we have to ask the patient, do you need me to move the phone, call light or water cup? The essential items we have to ask the patient whether we have to move the essential item near to the patient bedside. Next, last one is pump. We have to check the IV pump. If IV fluid is going on to the patient means we have to check the flow rate of IV and also whether the patient is having the any pain, that we have to assess patency of IV line. Also we have to monitor and when the IV line has started, the date also we have to assess, and the site of the IV, any signs of any signs of infection or something is there that you have to assess, or any signs of infiltration also you have to assess. Next, what are the advantages of conducting nursing round? So it helps to test the knowledge of the students, and at the same time we can know about whether we are knowing detail about the patient and the particular floor. And also the students who are informed prior to the rounds, the benefit of conducting this nursing rounds, it means that they are getting the real life teaching experience. No other type of rounds is substitute to nursing rounds. It provides the first hand information about the patient. Continuation with the advantages. This rounds helps in orienting new nurse and students to the patient. Rounds are interesting strategy, it involving the student, teacher as well as the patient. They offers the real life learning situation. Through a rounds, not only we are acquiring the knowledge, experience At the same time, we can evaluate the nursing activity in nursing care can be appraised. Next, move on to the what are the disadvantages of conducting nursing rounds. So it has many advantages. At the same time, a little bit disadvantages also it has. The confidentiality of the patient is hampered. Next, the patient may overhear the discussion and may not like the thought is being talked about. Distraction may be present in the ward. If a group is large, means the teacher may not able to speak loudly enough to be heard, in which the case the attention in that kind of case the attention of the individual who are on the fringes is lost. Sometimes unpleasant nursing rounds has little learning value. The value of nursing rounds depends upon the quality and presentation of the nurse teacher and head nurse. So that's all about the conduction of nursing rounds. So nursing rounds is essential step in hospital services. Through nursing rounds, staffs keenly observe the key aspect of nursing care for every patient. Not only the staffs, the students also, they can observe and they can gain the real life experience. Thank you all.